Who helps people experiencing post-polio conditions? Is it just doctors, or are there others involved? People who are experiencing post-polio changes are best helped by a number of clinicians and support personnel in what is called a multidisciplinary approach. This is similar to how other people with neuromuscular or complex health conditions are helped. Let's take a look at who may be on the health team. General practitioners are the primary doctors who monitor conditions and who refer their patients to clinicians in other health disciplines. Doctors who specialise in orthopedic surgery, neurology, pain management, pulmonology, and sleep health may also be a part of a person's medical team. Nurses in community settings and in hospital facilities are also in contact with those who are exposed to polio and those who have post-polio symptoms. They play important roles in monitoring medications and symptoms, screening for health conditions, and assisting with all phases of surgery. They also advocate for those who are hospitalised and improve the health literacy of clients and their families and carers. Physiotherapists assist those physically affected by polio with neuromuscular and post-surgical rehabilitation, exercise prescription and monitoring, gait training, fall risk reduction, and activity management. Exercise physiologists also prescribe and monitor exercise programs and help clients manage chronic conditions. Massage therapists are utilised by some who have muscle and joint pain or who feel areas of tightness limiting their mobility and activities. Massage is a way to reduce pain and restore lost posture. These therapists normalise soft tissues which have been negatively affecting posture, comfort, and circulation. Orthotists and Pedorthists played a significant historical role during the polio era, and they continue to help people needing custom supportive devices for polio-related symptoms to this day. They are often the clinicians who have maintained decades of contact with people who most identify as being a polio survivor. Those who have needed uninterrupted, long-term orthopedic management of anatomical asymmetries consult with orthotists, who prescribe braces and calipers. Pedorthists are consulted long-term to make or modify custom footwear. Occupational therapists can help reduce strain and make everyday tasks more efficient. They provide valuable personalised education on activity management and fatigue reduction. Along with assistive technology specialists, occupational therapists advise on, organise and fit assistive technology to lessen people's polio-caused impairments. Counsellors may be the most underutilised profession by those who experience polio. Polio caused physical changes affecting mobility for about 1% of people exposed to the virus, but rarely was intellect affected. In addition, many are self-determiners. For decades, they have created their own solutions to the barriers their society and environment contained. Hence, they can be sensitive or resistant to suggestions that their ability to cope with health changes may need professional intervention. Yet, they do benefit. Counsellors can help them address and resolve traumatic health experiences from their childhood, improve their mental health, and equip them with strategies to better manage the emerging changes from a condition they thought they would not face again. Aged care, the NDIS, and other support service workers have frequent contact with those who experience polio. They provide many different types of community and residential services and assistance. It is essential that these workers are well informed on the qualities of post-polio conditions. They should also be aware of the 4 areas where risk is present when working directly with post-polio clients. Social workers advise on and help manage access to federal, state, and community services which may benefit the quality of life and level of participation of those who experience post-polio conditions. Social workers can direct care services and may provide emotional support to clients and their families and caregivers. As you can see, there are quite a number of people who could be on the care team of someone who is experiencing post-polio conditions. Just remember that each person's care team will be made up of different professionals and each will use a different set of services. Each member of the health and care team should attend to enabling their client's quality of life by reducing or stabilising post-polio symptoms and by mitigating the 4 risk areas. They should keep in mind that post-polio symptoms are unlikely to be fully resolved, as these conditions are progressive and chronic. It is rare that a single discipline's interventions will be able to fully address a complex problem, or resolve a symptom like fatigue or pain. Knowing this, team members should think broadly about their scope of practice's effect and consider all the options in their toolboxes that might reduce the challenges being experienced by the person. Those with post-polio conditions benefit from conservative prescriptions, ongoing education, and consistent long-term monitoring from their health team. What can you do to be sure a person with a history of polio has the health team they need? If you are on a client's health team, be aware of how other clinicians and support services may be able to help support your client, and what professional education they may need to ensure good decision making. Carers or family members can advocate for the provision of referrals or encourage the engagement of services that may be of benefit to the person who experienced polio. Thanks for taking the time to watch this video. By understanding post-polio topics, you are helping to improve health outcomes. Visit Polio Australia's website for further information and to download resources.